Westmead's a really interesting place. The precinct as a whole, once you add all of those establishments together, is much greater than an individual actor within that. So you've got a major hospital, a private hospital, a children's hospital, and great research establishments. So from the council's point of view, that's the sort of shared vision that we're trying to harness in Westmead.
The objective of the project was to bring together all of the parties for the purpose of helping them to achieve their specific interests, but by combining them together in a master plan to create opportunities for them that wouldn't exist unless they joined forces, and also to create opportunities for others to join the precinct to give an uplift to the opportunities of the precinct.
So we had 11 organisations comprising of our consultant consortium, and our job as project manager was to bring these people all together. I think too often that planning for infrastructure happens in isolation of each other, and one of the biggest strengths was our integration of all of that and making sure that all these pieces fit together and we have an aligned message.
Westmead is not just about the health and education precinct in itself, it's about its place. The ways in which neighbours, near and far, can participate in master planning is a particular orientation that WSP brought.
We helped facilitate more than 50 stakeholder workshops, and we tested what are some of their aspirations and visions for Westmead, and distilled that down into 12 principles which guided the formation of the master plan. But more importantly, those principles will be used to help ensure that these stakeholder visions and aspirations are still coming through in the work that's being delivered.
This is a competition for jobs and talent and intellect at an international scale, and what we think attracts them to Westmead is the capability and reputation of the work that happens there. It's about focusing on what we agreed about rather than looking at particular vested interests. There's a high school and primary schools in the area, and they're oversubscribed, but there's also a broader metropolitan benefit about attracting globally talented and high-level medical researchers to not just work in this area, but also to get them to live in the city of Parramatta.
There are many lessons to be learned from the project so far. The first is, by bringing all of the parties of the precinct together and helping them to understand how each of their interests could be improved by combining their efforts together, has been a significant achievement. The second lesson learned is to think beyond the immediate place and think about the broader neighbourhood of interests. The third is to recognise the context of what's happening, and for us that was more broadly in Sydney, both from a planning point of view, an infrastructure point of view, and the opportunities for investment by others in a wonderful opportunity such as the Westmead Health and Education Precinct.